Changemakers is a movement created by the Manny Cantor Center, engaging New Yorkers to take action. I'm Eden Perlove with the America 101 Project. With my co-founder, Lily Nussbaum, we created the America 101 Project out of a desire to learn more about timely topics from the people who know them intimately and can share a unique perspective. Today, I am with my co-founder, Lily Nussbaum. Born and raised in New York City, Lily graduated with honors from Fordham University with a Master's of Science in Education and Mental Health Counseling. A musician and community organizer, Lily is a trained social worker, working with those who have anxiety, depression, or those who need help with interpersonal relationships.
Well, I am first and foremost co-founder of the America 101 Project, full disclosure. And I am a therapist, a mental health counselor, a certified crisis counselor. I was once a musician. I'm still part of a big, loving artist community. And those are the essentials, I think.
How are mental health and physical health related?
They are, they are inextricably related. You know, when we experience stress, when we experience something traumatic, whether or not we start processing the experience immediately, stress lives in our body. It can come out in different ways. Some people get headaches, some people get migraines, some people are overcome by nausea, some people experience hair loss or eczema. There are innumerable ways that stress, mental, psychological stress, turns into physical stress. They are completely related to each other.
How has COVID affected mental health?
I mean, how has it not, right? It's a really, it's a remarkable moment. There is no one who isn't affected by this right now in one way or another, which is a remarkable thing to think about. Not only that, we are having this shared universal experience, and at the same time, we are each individually having our own unique experience of this crisis. And it takes different shapes for absolutely everyone. Different communities are impacted, obviously. Minorities, communities of color are disproportionately affected by this. Asian Americans are being harassed on the street. Children of all ages, the youngest to teenagers, are going to be living with the effects of this for who knows how long. It's very hard at the moment to quantify the impact of COVID-19 on our mental health. The thing that I keep thinking about in my work with individuals, I work with adults only, but my experience is that so much of the stress and anxiety has to do with what we don't know, which is a lot. We don't know a lot. We don't know when this will end. We don't know what the outcomes will be. We don't know whether or not we're going to catch it when we go out next. The unknowns sort of compound and sort of pile onto each other. And something that I've found is helpful and has been helpful to the people that I work with and people that I know, friends and family, is taking a sort of short-term look at what we can control, what we do know, on the smallest possible scale. I'm not talking like what's in the news, what facts do we have access to? That's important too. But I'm thinking more on a personal scale. What can I do today? What can I do in this hour that I have some control over? that can alleviate some of the stress that I'm feeling because of the pandemic. That's something that I've been trying hard to focus on personally, and when I talk to others about mental health care in this time.
What are some steps that I can take to unwind when I'm at home?
So many different things, and it's really hard to say that because obviously we're all limited. There are parameters around what we can do right now. Um, some of the most interesting things that have been shared with me from some colleagues are these small sensory changes. The idea that if you are stuck at home, um, and if you're feeling particularly depressed or anxious, then even changing something sensory in your environment, drinking a cold glass of water, holding an ice cube in your hand. This sounds a little nuts, but it really does something. Taking a hot shower, opening the windows so that you get a blast of fresh air. If you're able, doing some kind of exercise or even stretching. Um, these little tactical things can have a huge impact very abruptly. And you can do them safely within your limited scope.
Who can I reach out to for help?
Um, well, can reach out to lots of people actually. I will give you a list of websites and places to turn to, but the government website, SAMHSA, the Substance Abuse and Mental Health Services Administration, they have a contact number, and I think they also have a texting platform, so you can text in any time. The crisis text line, which I've had the privilege of working for a few years now, they are available 24/7 if you feel that you're in crisis and you need to talk to someone immediately. You can text home to 741-741 and someone will talk you through it. Also, the National Alliance on Mental Illness, NAMI, I don't know. They have help services. If you're looking for more long-term care, and right now I think most, if not all, therapists are doing telehealth and working from home, I would go to psychologytoday.com. They have an incredibly detailed search engine. You can find therapists that you take your specific health insurance that are in your town or within a certain mile radius, certain sliding scale price points, people who specialize in different populations. You can really hone your search and find someone who's right for you. I really recommend this if you're looking for more long-term care.
Where should I go if I want to learn more?
I would look at the National Alliance on Mental Illness. I think it's nami.org. They have a whole COVID-19 information section on their website. It's really thorough. I would also stay in touch with your people, with your community. See if your neighborhood is doing anything to help the elderly in your community. If there's a way, if you are able and it doesn't put you at additional risk, to buy groceries and go to the pharmacy. There are certain things that we can do, or donate to local organizations, food banks. All of this is pretty easily Googleable, and it does so much. There are so many people suffering in a whole variety of ways in each of our communities. It's also really important to remember that you can't do everything. It is very tempting, as we know from our work in general, social justice issues. It is very, very tempting to want to do as much as possible. It's very hard to get something done when you're spreading yourself really thin. So my advice would be, if you are able, if you have the mental bandwidth, if you are able to give some time to helping others, pick one thing. Even if it's calling all of your family members or friends who might be struggling in a week, that's an accomplishment. try not to cover a ton of ground, because it's really easy to burn out right now. We are all sort of at like a foundational level of burnout. And it is really important that we save our strength, our physical and mental strength, and do what we can within reason.